Hello, everybody, and welcome to Healthcare Supply Chain Week. I want to congratulate everybody out there for, I'd say, several years of great effort and hard work. But we're going to be celebrating this year. It's the first week in October. I'm Justin Poulin from Power Supply. Joining me, Mike Schiller from AHRMM, Vicky Lyle from Owens and Minor. We are so happy that you're joining us. I know we're already into the second day of Supply Chain Week. It's Tuesday. The theme this year is the power of partnerships. And so, Mike, I'm going to go ahead and welcome you on and talk about why the theme this year of the power of partnerships.
Well, Justin, it's great to be here. And let me just start by wishing every supply chain professional a very happy supply chain professional week, supply chain week. We're excited to be highlighting the power of partnerships because if you look over the last 3+ years, Justin, it's really been about partnerships, right? The traditional partnerships with our distributors, with our manufacturers, key suppliers, our GPOs, um, partnerships within the community, which we're going to be looking to highlight in a couple of other upcoming sessions, not to steal your thunder, my friend, but we've really seen just this strong connection. And I'll tell you, looking at some surveys, talking with colleagues across the healthcare field, there's still this strong emphasis on partnerships and the need for strong relationships between key trading partners. And I think the last piece from a partnership perspective that I'd like to highlight is the continuing engagement of both the public and the private sectors. We're seeing just this strengthening of these public-private sector engagements in the areas of resiliency, in the areas of defining a common or a critical medical device list, in the areas of determining what does a digital supply chain look like. That was a meeting I was at last week, a public-private partnership. So everything we've seen in the last 3+ years is about partnership. And joining me, my colleague Vicky Lyle, right? This is the epitome of a partnership, right? I'll turn it back over to you, Justin or Vicky.
Well, no, Vicky, by all means, jump on that. And I think it is important that we highlight that the partnerships can be exhibited in lots of different ways. We're going to be hearing about community partnerships when we talk to Jeremy Strong and Eric Tritch coming up in a couple of interviews that we'll release out over the course of this week. But Vicky, from the supplier standpoint and your work at Owens and Minor, the partnerships are also between supplier and provider. I think these partnerships really run deep. Maybe talk about what this theme means to you.
Yeah, so the power of partnership for me is across both our providers and our suppliers. And it really is about, again, the behind the scenes supply chain that kind of makes it all work. And I too want to congratulate everyone in the supply chain professional world because you make it happen. And as Mike said, over the last few years, you've dug in and made healthcare run more smoothly. Now, for me, I get to work with industry associations and partner with industry to look at ways that we improve the supply chain. And Mike, AHRMM is a wonderful industry trading, association that allows us to all come together, and that's the power of partnership, when the different organizations can come together, work together to really look for those ways to make healthcare supply chain more efficient for everyone.
I'd say another area of partnership is just all the supply chain professionals and their partners with their internal team members. And I think that's a big part of this week too, is increasing that awareness. And Vicky, you talked about working, with professional trade organizations like AHRMM and the regional chapters, but also just making sure that everybody in the organization, which I would say they're probably more aware than they've ever been about the role that supply chain plays, but definitely, having a chance to talk to all those other department leaders and other folks that are working in healthcare, because really there's no other aspect of healthcare that touches every single department the way that supply chain does.
That's so true.
Yeah,
So
I like to call us the supply chain professionals the great conveners, right? We have so many internal relationships and partnerships within our healthcare organizations or healthcare systems. And then we've got all of the external relationships that we manage outside of the organization. And I'll tell you, one of the things that I think is unique to the supply chain leader is the ability to identify connections that others may not be able to identify, again, just because of the span of relationships that we do own.
that's
Yeah,
a really
I
good
would.
point, Mike.
What about from the supplier perspective, Vicky? I mean, a lot of the work is happening with supply chain, but you also, I would say, all of the suppliers, also advocate for supply chain in those relationships because they may be coming in through supply chain and they have a relationship there, but they also and have a relationship with those other departments. So I feel like there's a role here for everybody that's involved in healthcare to sort of champion this week and talk and about the good work that everybody has been doing, but also give them some credit right now and really highlight that.
Yeah, and we're celebrating all of our teammates at Owens & Minor. We have, thousands of teammates that work in warehouses every single day to get product picked, packed, and shipped, manufactured to the hospital on time. And we're celebrating supply chain all the way across the industry, the provider, the distributor, as well as the suppliers. And they all work together to make it work, right? It's an orchestration. And I know that there's been challenges recently with COVID and back orders and shortages, and all of these supply chain professionals have weathered the storm, and they continue to work behind the scenes every single day to make it all happen. And it's definitely a great week to celebrate the passion that we have for Supply Chain Week and our supply chain teammates.
Mike, I know we're kind of wrapping up. We're kicking this off and really highlighting the theme of the week and getting things started, between Power Supply and AHRMM. And then Vicky, you're joining us as well from the supplier side and from Owens & Minor. But I think that's a really great point, Vicky, that you mentioned is supply chain isn't, when we say healthcare supply chain, a lot of times people are thinking within the walls of the hospital or, within the actual delivery network or the provider network. But there are lots of other supply chain folks working in healthcare that are on the supplier side. I'm really glad that you pointed that out. Mike, I don't know if you want to add anything there too.
Yeah, just kind of in closing, we're talking about some of the traditional relationships, traditional partnerships that we've seen. Justin, you're absolutely right. The partnership between AHRMM and Power Supply is another great example of a unique partnership that falls outside the boundaries of what we typically would look at between distributors, GPOs, manufacturers, and the providers. I think casting an eye forward, the power partnerships doesn't end just because this year's supply chain, that's the theme. And when the supply chain week is over, we move on to a new theme next year. Now, I think the power partnerships lives long beyond this week and extends into the future. Some key areas I know that we've talked about on our podcasts are sustainability, decarbonization efforts. There's going to be new relationships, new partnerships forged in those areas. And human trafficking, a big program initiative that AHRMM is focusing on. And that's another area where you're going to see growing partnerships and relationships, again, outside these traditional boundaries. And I think that's really, to me, what the supply chain leader and the future of supply chain is all about. It's moving, it's strengthening the existing relationships within our traditional boundaries, and it's exploring and building relationships outside of those traditional boundaries.
Well, excellent. You both are going to be joining me for 2 more interviews. They're going to go out in the next several days as we continue to celebrate Healthcare Supply Chain Week. I thank you both for joining me to kick this all off. And I hope everybody out there that's listening is celebrating their efforts and the work. And if you're watching this and you don't work in healthcare supply chain, but you are in healthcare and you are in one of those supporting departments, make sure to introduce yourself if you haven't before to your supply chain teammates and thank them for the work that they've been doing. I can tell you back orders is one of those that has probably touched your department, and it's the people in supply chain, and they're working hard to help you navigate that and continue to deliver high quality care to your patients. So as we celebrate, I'm looking forward to the next couple of interviews, and you two will be with me. So be on the lookout here on the Power Supply channel, and it'll also be released via AHRMM's podcast channel as well. So I hope everybody is enjoying a great healthcare supply chain week.